So, in my presentation, I'm going to be talking about the effects of drugs on your teeth and your oral region. So, I don't know if you can see this, but I have a presentation I created that I'm going to be looking off of. So, the main effects that drugs cause in your mouth is dry mouth, tooth decay, bad breath, jaw pain, erosion of the enamel, and acid and sugar have a huge effect on your teeth, which I will get into later. So cocaine can be either smoked or you can snort it. But when you snort it, the hole in the roof of your mouth, you'll get a hole in the roof of your mouth because it will when you're snorting it, it goes in your nose and then it burns and eats away at all this tissue here, and then you'll get a hole through your mouth, which can cause difficulty eating and talking. And then the acid also erodes your enamel because cocaine is very acidic. Meth, also I forgot to say that I'll be just explaining the effects of many different drugs, which is like cocaine, meth, heroin, tobacco, marijuana, ecstasy, fentanyl, and so on. So meth causes your teeth to be black. Also tooth decay, loose teeth, bad breath, gum disease, dry mouth, and 98% of people that do meth have cavities that are not taken care of. Heroin causes rotten, discolored, broken teeth. Gum disease, it can be used most people use it as a painkiller because they don't really feel much when they're on it. And so when they have a cavity, it gets left untreated because they don't feel it because they're using the heroin as a painkiller. And it's kind of like when you have a headache and you take Tylenol or something, and then you don't feel your headache anymore, and so you don't worry about it. And so that is what it's like for the people that are on heroin, is they do that, but with their cavities or any tooth problems. Marijuana causes mouth cancer, and if you use it for long term, which is over a year, it can cause a syndrome called cannabinoid hyperemesis. I don't know if I said that right, but the syndrome causes severe nausea and vomiting, and it comes in 3 stages if you have it. So the first stage, you're usually nauseous or you vomit in the morning, and then the second stage is the worst stage, where you're constantly throwing up, and then people will tend to take showers more often because it makes them feel better. And then the recovery stage is obviously when you're starting to feel back to normal and you're showering normal amount of times, not all the time. And then tobacco can cause gum disease, and it also will cause slow healing. So say you have an extraction, it's going to take longer for your blood to clot and for all your tissues to come back. And it also can cause oral cancer, stain your teeth, and then chewing tobacco causes gum deterioration, so your gum is going to start pulling away from your teeth because it's always sitting here in your gums and then just slowly just eating it away. And it causes tooth decay, and then some people see white patches, and then mouth cancer, and cause sores and stuff. And then sometimes people actually do get holes through their whole tissue there, and so you can see right into their mouth because the tobacco is just eating away at all their gum tissue. And then e-cigarettes is a new thing, so they don't have much on it, but they say that the sweet flavors that you can get tend to cause tooth decay. Opioids are usually prescribed after an extraction, and teens tend to overuse them when they are prescribed from an extraction like wisdom teeth. and 33% are more likely to overuse when they are prescribed. And so if you don't really want to take that risk of becoming addicted to it, you can talk to your doctor about like if your family's got drug abuse or if you had struggles with drug abuse, you can talk to them about other options because there definitely are other types of pain meds that they can give you that aren't as strong, which might not actually work, but it's the best you can do. And then Molly can cause nausea, vomiting, grinding, hyperactivity, and tooth decay. Ecstasy causes grinding and clenching. So if you're always clenching, then you're probably going to experience jaw pain because it's always so tight. And then grinding, people with like that are on Molly and ecstasy, when you grind your teeth, it's going to start wearing away, and then you won't have much of your teeth left. And ecstasy is considered a love drug because they tend to lace people's drinks with it, and then it knocks them out, and then they'll usually rape them. And then fentanyl causes loss of appetite, dry mouth, cough, vomiting, sore throat, sores, ulcers, and it is very dangerous. It is one of like the strongest drugs, and it's bad to even be around, like even to breathe it in. And so even like cops and investigators have to suit up because of how strong this drug is. And so going back to where I had the main effects. So as you can see, a lot of the drugs cause dry mouth, which you don't want because you need saliva to keep flushing out your mouth and keep everything off of your teeth. Because if you just let it sit there, it's gonna just coat your teeth and like keep like rotting it away. And then obviously tooth decay, because most drugs are very acidic, and acid eats away at your teeth, causing decay. And then if you're also throwing up, which is that when you throw up, you had all that acid coming up, and then that's also eating away at your teeth. And then if you're not brushing your teeth or cleaning your teeth after you just throw up, then all that acid is just going to sit there and just keep eating and eroding away at your enamel. Bad breath, obviously, most people get that because drugs don't taste or smell very good, and that will leave like that smell in your mouth. And jaw pain is also another very common one because people are always either like very tight, so they're clenching all the time, or they tend to get like anxious, nervous, so they're biting at their cheeks, and then that can cause jaw pain because you're constantly chewing. And then jaw pain can also be from grinding if you're constantly like moving your jaw and your teeth like at night or just in general because you're on the drugs. And erosion of the enamel is usually from the acid that's constantly in your mouth, but also from just letting all the drugs just sit on your teeth. And then sugar also can cause decay, and some drugs might like have either like a sweet flavor that will like be sugary and like have the same effect. Otherwise, you might actually crave like sugary foods and always eating sugary foods from these drugs, and then that will also cause this decay. And the reason why people have such bad teeth usually when they are taking or using drugs is because they don't really go to the dentist as regularly as they should, and they don't have very good at-home care because they haven't gone for many years to the dentist to even know how to properly take care of their teeth. So some treatment, it really depends on the drug because every drug is different, so you can't put it in like a generalized category. But if you do go to the dentist, they could put fluoride on your teeth, which like strengthens it and helps prevent your enamel from eroding away. Or if you do go to the dentist, they can do some type of restoration, like filling or root canal if it's really bad, if the decay is close to your pulp. They can do an implant if they want to extract your teeth, or if they extract it all because there's no way to save it, then they'll just put dentures in. So some ways you can prevent all these problems is you can talk to your doctor about quitting. That way it doesn't get too bad where your teeth are this bad. You can avoid sugary foods and drinks, which goes to anybody really, even if you aren't taking drugs. And then at home care, you really want to keep brushing your teeth and flossing every day, and not just brush once a day because you don't want things just sitting on your teeth. And then also to visit the dentist frequently. And I did make a brochure that I can show in a second.